Very good evening, one and all. I am Arpita from the IGCP group, the moderator for today's session. The topic that we are going to discuss today is evidence based dietary approaches for weight management. And yes, to address the topic, we have with us very eminent dietitian Smita Shah ma'am. It's an honor for me to welcome her and to introduce her to everyone. Ma'am has done post graduation in clinical nutrition, LLL certified in metabolic syndrome by European Society of Clinical Nutrition and Metabolism. She's a dietitian and obesity consultant at Dia Care Diabetes and Hormone Clinic at Ahmedabad. So, ma'am, with this brief introduction of yours, now I would request you to please start with the topic for today. Over to you, ma'am.
Yeah, good evening, everyone, and thank you, Matt Talks and Ankana, for giving me an opportunity for giving me the talk. My topic is the evidence-based dietary approaches for the weight management. We all know that more than 650 million adults worldwide suffering from obesity and the prevalence of the conditions that increased rapidly during the past 50 years. Obesity has become one of the part of the important public health problem globally and is strongly associated with the type 2 diabetes, also cardiovascular disease, and also cardiac disease, also depression, and sometimes of the cancer. So, what are the what we can do to prevent the obesity? So, I mean, an ideal diet is characterized by being the safe and nutritious culturally approach, and it should be economical, viable, and sustainable over the long term. It should be all the facility adherence to the dietary guideline. So today we will discuss the evidence-based dietary approaches for the weight management. So there are a number of dietary approaches for the weight management. Just a minute. Okay. So today my agenda of my talk is the weight management. We will discuss regarding the weight management. Second is the evidence-based dietary approaches, effect of the diet of healthcare parameters, enhancing the healthcare team outcomes, and choosing a right diet. So the weight management, the center of the disease control defines weight management as a process of the adopting the long-term lifestyle changes to maintain a healthy weight. So this is not for the short time. We must consider obesity as a disease, and it should be lifestyle modification, and duration should be not short time. The CDC recommended the following for the weight management. First is the healthy eating. That is most important. Eat a variety of fruits, vegetables, whole grains, healthy fats, and the protein sources, limited added sugar and sugary drinks, and get enough water. So physical activities, that is most important. The dietary only diet will not work. You have to do some physical activity, and at least as per the ADA recommendation, at least 150 minutes per week of moderate intensity activity. It should be recommended for the weight loss as well as the management of the diabetes. Now, the third problem is the stress. Stress is the main cause of the obesity. The stress reduction, that is the most important. This is also part of the treatment. So, engage in the stress reducing techniques like you can go for the yoga, your meditations. So, that is most important. And the last one is the sleep. Sleep is also more important. Nowadays, the insomnia is very common to the all type of the people, even in the adult as well as in the geriatric, and this is the main cause of the obesity. So at least get optimum sleep, at least 7 to 8 hours sound sleep is necessary for management of the obesity. And gradual weight loss should be recommended. The weight loss should be 1 to 2 pounds per week is recommended, not very quick weight loss is important. So these all are the weight management problem. Now the strategies. What are the strategies? The basic strategy is the dietary therapy. That is the most important. Dietary therapy is the cornerstone therapy for the management of the weight. Second, sorry. Then physical activity, that is the most important. Behavior therapy, that is the most important. You must teach your patient how the mindful eating it works, and the combined therapy. If the dietary therapy and the physical activity is not working, we must include the pharmacotherapy for the management of the diabetes. When the BMI is greater than 30 kg per meter square and you have comorbidity like diabetes and hypertension, you must introduce the pharmacotherapy for the treatment of the weight loss. And the last is if you have the morbid obesity, you should go for the weight loss surgery. This is the protocol, the treatment of the obesity. So evidence-based nutrition recommended age develop are developed through the use of the systematically review scientific evidence in making the food and nutrition practice decision by integrating the best available evidence with professional expertise and the client value to improve the outcomes. So now that a number of dietary approaches is popular, so there are a number of and the people try to each type of the different type of the dietary approaches for weight loss. The first is the low fat diet, second is the low carbohydrate diet, Mediterranean diet, Atkins diet, Paleolithic diet, vegan diet, intermittent fasting, very low calorie diet, and the meal replacements. These all are the dietary approaches for the weight management. Now we will discuss regarding the diet approaches. The first is the low fat diet is very common, and in that the calorie restriction is the main important. The low fat diet tends to reduce overall calorie intake because fats are the calorie dense. It provides 9 kilocalories per gram compared to 4 kilocalories per protein and the carbohydrates. So reducing the fat intake can help to create a calorie deficit, which is essential for the weight loss. It consists 20 to 50% of the energy from the fat. And recent meta-analysis of the trial comparing the efficacy of the low-fat diet to a low-carbohydrate diet showed that the low-fat diet was less effective than a low-carbohydrate diet in achieving sustainable long-term weight loss. But how it helps? So it's first it's improve the fat metabolism, it's improve the cardiovascular health, it increase the satiety because low fat. When you are going for the low fat, definitely you will include more fiber and the protein, so it will increase the satiety. If the patient is the diabetic, it will the better sugar control, better and weight maintenance. Diet variety is also possible. If you start diet variety, so it will long sustainability and reduction in the insulin resistance and long-term sustainable eating habits. So these are the benefits of the low-fat diet. Now the low carbohydrate diet. Now it became the very popular, the low carbohydrate diet. Nowadays, even for the reversal of the diabetes and the remission of the diabetes, we recommended the patient, diabetic patient, yeah, the pre-diabetic patient, very low carbohydrate diet. So a low carbohydrate diet can be defined as less than 45% of the dietary energy sources from the carbohydrate, and a low carbohydrate diet typically contains 52 to 150 grams of the carbohydrate per day. As per the ADA guideline, ADA recommendation for the diabetic patient should not be used less than 130 grams of the carbohydrate in your daily intake. So how it has is useful to weight management? The first is reduce the insulin level. Generally, most of the obese patient are overweight patient are insulin resistance and they are hyperinsulinemia. So it helps to reduce the insulin level. It improve the blood sugar and the insulin sensitivity. If the patient is pre-diabetic or diabetic, it's definitely help to improve the blood sugar. Is quick initial weight loss, an improvement is also the cholesterol profile and sustained energy level. The low carbohydrate diet is very practical and very beneficial for the obesity. Now the Mediterranean diet is also very popular. The Mediterranean diet is based on the popular diet in the Mediterranean region such as Italy and Greece. The Mediterranean diet is rich in fruits, vegetables, nuts, seeds, seafood, fish, and olive oil. The primary source of the nutrients is plant based, rich in fibers, lower in glycemic load, and high in antioxidant and micronutrients. In addition, in lower is saturated fat and omega 6 fatty acid, polyunsaturated fatty acid, and PUFA, and higher in the monounsaturated fatty acids, MUFA, and omega-3 polyunsaturated fatty acids. So it's also rich in the omega-3 fatty acids. So Mediterranean diet is very popular for controlling the diabetes as well, the cardiovascular disease, as well as for the control the weight. It improve the cardiovascular health. It reduce the risk of stroke. It lower the risk of type 2 diabetes. Also, it helps to reduce the inflammation due to its antioxidant food. It improve the cognitive function and the brain health. It's also good for the better gut health, and is also help in the cancer prevention. Is better mood and mental health due to antioxidant and the omega-3, and support for the healthy skin. So the Mediterranean diet is also very helpful to the patients of the obesity as well as the hypertension as well as cardiac disease. Now the Atkins diet. Atkins diet is very popular. Earlier it was very popular. Dr. Robert Atkins originally promoted the Atkins diet. The Atkins diet is low in the carbohydrate without any restriction of the fat or protein content in the diet. So in Atkins diet, they focus on the high protein and no restriction in the fat. So Atkins diet is high in the protein, which more than 20 to 35% of the energy and in diet comes from the protein. And the high protein content of the diet can lead to the browning of the white adipose tissues. So it is help to browning the fat. Now, how it's helped? So, because it's due to high protein diet and high fat diet is reduce the appetite and increase the satiety level. That is most important, the satiety effect, because thermogenesis effect, and it increase the totally energy expenditure because it content more protein and fat. So definitely it will increase the energy expenditure, improve in the glycemic control for the diabetic patient, and improvement in the triglyceride and HDL cholesterol. The Paleolithic diet, this is the diet refers to mimicking the dietary pattern of our ancestors before agriculture. This is the mimicking of that diet, and it relates to diet during the hunting and gathering lifestyle. There was no single Paleolithic diet as varied accordingly. It's a likely geographic religion based on the climate and food availability. There is no typical Paleolithic diet, but it's depend on the geographical conditions. The Paleolithic diet include the primary source of the energy for the plant-based food. It consists of the whole foods, fruits, nuts, seeds, legumes, vegetables, and protein and fat from the meat and fish. And the carbohydrate consumed was low glycemic and rich in the high fiber content. So it's a improve. How is healthy? Paleolithic diet improves the insulin sensitivity, reduce the risk of cardiovascular disease, and helps to achieve the weight loss on a short and the long-term basis. And the long-term sustainability of the Paleolithic diet is questionable because, of course, it's a high cost and is little bit not palatability. Now the vegan diet. Vegan diet is also become very, very popular. And a vegan diet include only the plant-based nutrients, excluding meat, fish, dairy, and the eggs. So there are so many right now, so many people they are follow the vegan diet. A recent meta-analysis of the 12 clinical trials shows that the individual assigned to a vegetarian diet lost more weight than those who assigned to a non-vegetarian diet. So the significant more weight loss was detected in the subjects on energy restricted vegetarian diet versus those without any energy restricted diet. So vegan diet is also help to reduce the weight. Now the intermittent fasting, that is this concept is become very, very popular nowadays. So intermittent fasting is a dietary approach where there are time period fasting without any restriction of a particular macronutrients. The overall rationale for the weight loss based on the intermittent fasting relies on broad calorie restrictions. So many randomized control trials shows that evidence of the weight loss from the intermittent fasting. The intermittent fasting could be alternate day fasting. In some time they recommended the alternate fasting. And time restricted eating, where nutritional intake happens only during a fixed time window. So, there are also beneficial effects for the intermittent fasting. It helps to better glucose control for the diabetic patient. Is beneficial effects on the weight reduction because only two times the patient is eating, increasing the insulin sensitivity. It will help increase the sensitivity because no munching, no other food, and improve the blood pressure control, improve the cardiovascular, and it has potential to slow down the progression of the neurodegenerative disease like Alzheimer and the Parkinson disease. So nowadays, the intermittent fasting has become very popular for the weight loss. Very low calorie diet. These diet are based on the concept of the calories in, calories out model. A low calorie diet consumes 1000 to 1500 kilocalories per day, but very low calorie diet it consists 600 to 800 kilocalories per day, and low carbohydrate less than 30 to 50 grams per day intake along with the adequate protein intake 0.8 to 1.2 grams per kilo ideal body weight, but it is used for a short period and followed by a transition to the low calorie diet. The very low calorie diet is not possible for the long time, it is very for the short time. So a recent meta-analysis of the very low calorie ketogenic diet demonstrated improvement in the weight, BMI, HbA1c, blood pressure, total cholesterol, and triglyceride over a short period. The weight loss benefit from very low calorie ketogenic diet was demonstrable over 2 years, and no changes in the LDL and HDL were demonstrated as a result of very low calorie keto diet. Now, meal replacement. Meal replacement are used to create a negative energy deficit. People tend to overestimate or underestimate the calorie content of the food. Most of the patient not judge the calorie of the food. So this is the best idea for the patient who wants to reduce the weight because meal replacement give you the fixed calories that we can judge it. So meal replacement can replace one or more meals. They are convenient. Multiple commercial products are available. Additionally, their costs are vary by product. So the meal replacement is good for the snack replacement. Yeah, one meal replacement you can take it, and it's very convenient. You can who have more traveling and more meeting and more busy, so they can use a pouch. It's coming also in the pouch, so it's very convenient, and it has a fixed calories, so it helps to calculate the calories. So, a systematic review studying meal replacement demonstrated a mean weight loss of 2.2 to 6.1 kg compared with the other diet involving support alone. So, the meal replacement are not successful in the achieving the long-term weight loss due to physiological adaptation and decrease the energy expenditure. This adaptation lead to a plateau effect in weight loss trajectory. So, meal replacement is also help, but not total meal replacement is will be not consistable for the patient, as well as meal replacement also help to patient with the snack replacement, yeah, in the mid morning, yeah, mid afternoon snack replacement. It will help to calculate the calories for that. Now these all are the different now these all are the different meta-analysis study, and it shows that the weight, how the different type of the dietary approach helps in weight, BMI, triglyceride, LDL, HDL, and all type of HbA1c, systolic blood pressure and the diastolic blood pressure. You can see, so the low carbohydrate, this the signal green circle is the good results. So you can see that low carbohydrate diet has a good effect on the weight, also HDL, triglyceride, also and the HbA1c, and the gray dot as a no effect and red as a negative effect. So you can say different type of the diet and how they affect on the weight, BMI, and uh, cholesterol level as well as the HbA1c. So all diet has typical and all diet has good benefit, and some diet has effect on the weight, some diet effect on the lipid profile. So all diet have their special for the dietary pattern. So how to choose the diet for the patient. So remember, one size doesn't fit for all. Similarly, one diet plan doesn't suit all. So it should be individualized, and it should be as per his physical activity, as per his profession, as per his like and dislike. You should try to plan his diet. So what are the conclusion? So there is no single best diet strategy for the weight management, although some evidence-based method have been suggested. Reducing daily calorie intake is the most important factor for the weight loss. Low calorie recipes, especially those for the low fat and the low carbohydrate diet, have been suggested as the first dietary strategy. Although in some cases a very low calorie diet is required for a short period. So very low calorie diet is not for the long term, it's only for the short time. Expect energy deficit. There seems to be no significant difference between the macronutrients composition based diet. Improvement in the cardiometabolic factors strongly depends on the degree of weight loss. However, as in the Mediterranean diet, increasing the consumption of fruits and vegetables and intake of the healthy fat, including the monounsaturated as well as the polyunsaturated fat, can be a healthy strategy for the weight loss and the maintenance. Additionally, increase the protein intake can help for the weight loss and the maintenance. So, ask about your weight loss goal. When the patients come to you, ask about the weight loss goal, lifestyle, and the health conditions. And preference, it should be preference. Consider likes and dislike about the diet. That is the most important for it's a part of the job of the dietitians. It should be individualized and tried and whether the prefer the work along with a group. It's a weight management is you should it's a teamwork, a dietitian, endocrinologist, physiotherapists, a psychologist. So a team can work this. And second important thing is the budget. Some diets may require to buy the supplements or meal. So if the patient is not affordable, you cannot prescribe them the very costly diet pattern. And the culture is most important, religion and or ethnicity. This may play a role in the food choices. So you must preference to the culture, religion, and the ethnicity to plan the diet. So these are the most important thing because it's a not short time; it's a always long time. So we must consider obesity as a disease is not a temporary. It should be lifestyle modification, but throughout the life, it is not for the temporary. Thank you very much.
Thank you, ma'am. Thank you so much for such an insightful talk.
Yes.
Ma'am, now can you go to the questions?
Yes.
The first question is, ma'am, what role do intermittent fasting and time restricted eating plan play in weight management, and what does current research suggest about their effectiveness?
Yeah, the intermittent fasting is we have two windows for eating, and in that window they must eat the very nutritious food. That is the most important. Then sometimes what's happened, the patient do intermittent fasting, but in eating windows, they are eating more high calorie foods and no restrictions in the high calorie foods. Okay, so they mean that two times we can eat anything. So that will not work. So you have to plan the diet. It should be nutritious. It not be very much high calories and not be very much calories. And sometimes what's happened, the patient have doing intermittent fasting, they are eating five rotis, six roti in one meal. So it will not work. So that the most important is two times you are eating your eating window, but you should eat very healthy diet as well as low calorie diet. Otherwise, it will not give you the weight loss.
Right, ma'am. Thank you so much. Next question is, ma'am, what is the importance of protein intake in weight loss and its role in preserving a lean body mass?
Okay, fine. In the India, we all Indians have the lower muscles mass, and especially the obese patients, they have very fat. They are deposit fat, and then sometimes their muscle mass is very low. So at that time, the definitely protein will work. The protein high, not we are recommended high protein, but as per his daily requirement, if the patient take enough protein, so it will give the long term satiety. And second thing, it will the hypothalamus effect, so the long term satiety, as well as it will help to reduce the weight, as most of the people are obese patient are insulin resistant. So definitely it will help to reduce his insulin resistance, and it will help to reduce his weight as well as insulin resistance and increase the insulin sensitivity.
Right, right, ma'am. Thank you so much. Um, Next question is, how can calorie restriction and micronutrient composition be tailored for patients with metabolic syndrome or insulin resistance?
Insulin resistant, of course, if patients are insulin resistant and patients are overweight or obese, so you must go for the low calorie diet. So in that diet, of course, we can plan the diet as per the patient's requirement and the macronutrients. But in the macronutrients, we can give the low healthy fats, so it will be beneficial like monounsaturated fatty acids, polyunsaturated fatty acids, and limited the unsaturated fats, as well as enough protein. And the carbohydrates should be focused in the low glycemic food and high fiber. This is about the macronutrients, but what about the micronutrients? Most of the patients, obese patients, have deficiency of the vitamin D, that is most common. Vitamin B12 is most common, so we must focus on that two vitamins. So we must recommend them at least one food group that it increase the B12 level, like animal food group, animal food. It will help to increase this B12 level. Otherwise, it should be given the supplement. And the vitamin D also we can give them the supplements. Otherwise, some type of the food that helps to increase the vitamin D. Sometimes patients are uh, low of the iron level, means low hemoglobin level. This is very common in the obese patient. At that time we recommended them to the diet which high uh, food that high in the iron level is containing the iron level. So at that time we must focus on the macro and the micronutrients to plan the diet for the obese patient, as well as regarding the insulin resistance. So insulin resistance for patients, so we recommended them the low glycemic load and low glycemic index food, as well as good amount of the protein, and the regular exercise will definitely help.
Thank you, ma'am. Thank you so much. So these were the queries for today. Thank you so much, ma'am, for putting your effort for making such a beautiful presentation and solving all the doubts that our audience have. So thank you so much, ma'am, once again, and thanks to all the audience for joining in and making the session and a very engaging one. So thank you once again, ma'am. Thank you so
Thank
much. Thank you.